Hey gang, Mark Sweeney here from Austin Dental Spa. If you've tuned into Wisdom Wednesdays before, you know what this is all about, but welcome to Wisdom Wednesday. This is significant because it's the last one of the year. If you're wondering why I'm wearing this goofy hat, then you haven't checked in this month of December so far, because I've been wearing this every Wednesday in the month of December because we have a theme every month, and this month it was a December to remember. Ding! So I'm going to retire this hat until we come up with some other theme that's thought related, but we've had fun with that theme of bringing new scientific breakthroughs to you. This week is no different. This is going to be a fun one to end the year. I wanted to do something really special. You've probably seen everywhere you open social media, the newspapers, they're looking back at the year already. Hey, what were the best things that happened in 2022? There were a lot of things that happened, good and bad. So we're going to do no different. We're going to talk about some new scientific breakthroughs, new medical breakthroughs that happened in the month of 2022, or the year of 2022, that you may not be aware of. Give me 5 minutes and I'll make you aware of them. There's about 4 of them that I thought were really top breakthroughs that 2 of them I wasn't even aware of. This one I was. There's a brand new drug. If you know LDL and HDL, those are your 2 different cholesterol types. HDL is so-called good cholesterol. LDL is the bad cholesterol. You want that to be under 70 when you do a blood panel. And it's LDL stands for low density lipoproteins. Only medical people really give a darn about that. But anyway, the significance is the higher your LDL is above 70, the more likely you are to have bacterial plaques running around in just a sticky substance, whether it has bacteria in it or not, that are running through your bloodstream, and it builds up in the inside walls of your arteries, which makes the arteries smaller in diameter, which means your heart has to work harder to pump blood through. And so it makes your heart work harder. Well, it's a muscle like every other muscle in your body. It can get tired out. And if your arteries aren't expanding as well as they were supposed to, it can cause all kinds of problems, strokes, heart attacks. So lowering LDL is an important thing because it doesn't make your heart work so hard. So there's a new drug called inclisiran, and that, in addition to statins, which have been out for many years, lowers LDL by up to 50%. That's huge in the medical world. If you're a cardiologist, you're getting pretty excited about a new drug like that. It just came out this year. A second new one, it's only going to be interesting for about half of my audience, postpartum depression. The other half, the guys, well, you might have experienced it secondhand, but it's no fun. I've had many patients that suffered for up to 6 months after having a baby with postpartum depression because there were changes going on in their brain. And so they've come up with a new drug, funny name, allopregnanolone. They had to get the PREG in there. But anyway, this drug is administered IV, just came out in 2022, and it is administered IV for 60 hours, which seems like a long time until you understand that the previous treatments took weeks to take effect. This 60 hours and had almost complete remission of the depression effects, the postpartum depression. So that's huge if you're a pregnant female worried about that you might undergo that, because it is kind of debilitating to have something like that going on after you've just had a baby. 3D printing of organs. This is another one. They've been doing that for a little while. My oldest son, 25 years old, went to Carnegie Mellon, and the year that he went there 7 years ago, there was a professor in the anatomy department who was 3D printing aortas. Now they've gotten to where they're 3D printing organs like bladders. They've figured this stuff all out. The ramifications of this are huge. Instead of being on a donor list or a recipient list, you don't want to be on the donor list for liver, kidneys, something like that. Some people are on a list to get an organ transplant, particularly livers seem to be hard to come by these days, for 6 months to a year. Imagine if you needed a heart transplant and they could take some of your cells, 3D print a heart that was an exact duplicate of yours when it was healthy, impregnate your cells into it and grow them and have a heart that no one else has ever used before. The ramifications are huge. But they're actually doing that. They're 3D printing internal organs. The fourth technology and last one I want to talk about, and I'd heard of this before, CRISPR, CRISPR. Can't tell you what it stands for, 6 long words. But anyway, it is gene editing therapy, and you may have heard something about this during all the coronavirus pandemic, that they can actually take a DNA is a double helix strand, and they can actually cut DNA at specific points and remove or replace or modify specific genes and chromosomes with this technology on a miniature basis like that. They're actually looking at the DNA in your cells. So again, huge ramifications if you have something like cancer. This might be the first real breakthrough that allows us to have a realistic shot at eliminating cancer from the human race. We're still years away, but this technology is pretty exciting, that you could go in and take a mutant cell, which is basically what cancer cells are. They're cells that have different DNA than the rest of your body, and they grow on their own. If they can go in and change the DNA in those cancer cells, what do you think that would be if you were suffering from cancer right now? So those are 4 technologies that are brand new on the market in 2022. Imagine what 2023 will be. I hope I'm standing here this time next year telling you about the medical advances in 2023, and they're even more exciting than these 4. My health tip of the week, I always give a health tip at the end. With New Year's Eve coming up, you know, last week we talked about sweets and how to deal with sweets when you're at holiday parties. Well, alcohol is usually a part of that too. And of course, this weekend, the DUI people will be out in force. It's a no refusal weekend again in Austin, where if you get pulled over, you can't tell them, no, I don't want to do a blood test. They have court orders that they can do it. So alcohol is going to be part of this weekend. Not only are we concerned about the sobriety issue of it, but also alcohol dries your mouth out. And that's what we worry about as dentists. People that drink a lot tend to have really, really dry mouths, and that lends to more plaque buildup and a higher incidence of decay and potentially oral cancers and other things that you don't want. So my health tip for the week: drink a glass of water in between every alcoholic drink to keep hydrated so that you don't get dehydrated. It's not that hard to do. I've done it myself. I try to do it continually, where at least I take several sips of water in between each drink if I'm on a bender on New Year's Eve. So try that and see how it works out for you. Otherwise, have a safe and happy New Year, and I will see you next year with a new theme in the month of January and a new year in 2023. So long, be safe.